So, good afternoon, students. Today, we are going to discuss water-soluble vitamins. So, specific learning objectives for today's topic are: we are going to discuss about metabolism, biochemical functions, deficiency diseases, which are associated with inadequate intake and toxicity of this ascorbic acid or vitamin C if it is taken in excess quantity or if it is given haphazardly. See, before going to discuss about its introduction, there are three important questions. They are quite important. First one is, what is vitamin? How vitamins are classified, and how fat-soluble vitamins they are differentiated from water-soluble vitamins. Metabolic integrity, that is the vitamin. So vitamins, it is an organic compound that is required in small quantities for maintenance of normal metabolic integrity. Now, as we know, these vitamins, they are classified broadly into two groups: fat-soluble vitamin and water-soluble vitamin. So overall, there are 13 vitamins. They are classified as a fat-soluble and water-soluble vitamins. So the fat-soluble vitamins, these are for vitamin A, vitamin D, vitamin E, and vitamin K. Whereas water-soluble vitamins, there are total 9. In that, first one is our today's ascorbic acid, that is vitamin C, and 8 vitamins, they are from B complex family or B complex group. Now, next most important question is, how will we differentiate the fat-soluble vitamin from water-soluble vitamins? As the name itself suggests, in case of fat-soluble vitamins, they are soluble in fat and not in water. So they are fat-soluble vitamins. Whereas water-soluble vitamins, they are soluble in water but not in fat. They are called as water-soluble vitamins. So first differentiating point is regarding its solubility. Second one is about its storage. So almost all fat-soluble vitamins, they are stored in liver. Whereas water-soluble vitamins, they are not at all stored in our body. So regarding its storage, fat-soluble vitamins, they are stored in liver. Water-soluble vitamins, they are not at all stored in our body. Regarding its excretion, see, fat-soluble vitamins, they are not excreted out from our body. They are stored particularly in the liver. But in case of water-soluble vitamins, they are eliminated out or they are excreted out via urine. Now next differentiating point is regarding its toxicity. See, any excess intake of fat-soluble vitamin or haphazardly given the large or mega dose of these fat-soluble vitamins, they cause a clinical condition called as hypervitaminosis. But in case of water-soluble vitamins, hypervitaminosis is not possible because the water-soluble vitamins, they are eliminated out via urine, but which is not the case in case of fat-soluble vitamins. Now, next differentiating point is, in case of fat-soluble vitamins, they require transport protein or carrier protein to reach the target organ for their biological function. So they require a carrier proteins or a transport proteins. In case of water-soluble vitamins, they do not require a transport proteins to reach their target organ. So these are some differentiating points. First one is regarding its solubility. Second one regarding its storage. Third one about its excretion. And fourth one is about its toxicity. Then about carrier proteins. And last point is treatment point. In case of fat-soluble vitamin deficiency, usually a single dose or a mega dose may prevent its deficiency. But in case of water-soluble vitamins, we require a multiple doses for a certain period of time. So this is about the differentiating points between fat-soluble vitamins and water-soluble vitamins. So today we are going to discuss versatile vitamin, that is vitamin C or ascorbic acid, and this vitamin C plays a very important role in health as well as also in disease. As we know, deficiency of vitamin C, it causes disease called scurvy. And this particular disease, scurvy, has been known to us since 16th century. Various sailors, so in 16th century, various sailors from European countries that traveled on voyages in search of new land or new world. And during their journey, they were totally dependent on seafood. So ultimately, most of the crew members, they get affected by this one mysterious disease or a strange disease and lost their lives. And ultimately, the main attempts were made to identify this mysterious disease. And ultimately, in 1753, James Lind, a physician of English Navy, he identified this disease as the scurvy, and he published a book, Treatise on Scurvy. Later on, in 19th century, that is in 1920, Silva and his associates, they isolated a compound from lemon juice, and to that compound they named as a hexuronic acid because that compound is having a structure which is similar to a carbohydrate hexose. So this particular compound is having anti-scorbutic properties. So what do you mean by anti-scorbutic properties? Simply, say anti-scorbutic properties means nothing but this compound is having certain properties which can prevent the scurvy. So those properties which prevents the scurvy, ultimately it is called as anti-scorbutic property. So in 1928, Silva and his associate isolated a compound in lemon juice, and that compound they gave the name hexuronic acid. Ultimately in 1930, Albert George, he discovered or he suggested the name to that compound as a vitamin C. And Evo in 1933, he discovered or he elucidated its molecular structure, and he renamed that particular compound as an ascorbic acid, and ultimately for his work, this award he got the Nobel Prize. So this is all about its introduction. Now, let us discuss about its biosynthesis. See, most important point, man and higher primates, monkeys, guinea pigs and bats are the only species which cannot synthesize this vitamin C or ascorbic acid because we all lack the enzyme L-gluconolactone oxidase. So we cannot synthesize the vitamin C or ascorbic acid in our body because we doesn't have an enzyme L-gluconolactone oxidase. So this is a very, very important MC. Now, in case of most of the animals and plants, they can synthesize this vitamin C or ascorbic acid from glucose via uronic acid pathway. Then this vitamin, as we lack the enzyme N-gluconolactone oxidase. This vitamin C must and should supply in diet. Then next point is ascorbic acid. As shown in this diagram, this is the ascorbic acid, first one, and second one is the dehydroascorbic acid. Both these are the active form of vitamins. So what are the active forms of vitamin C? There are two: ascorbic acid and it's a dehydro form, that is dehydroascorbic acid. They are the active form of vitamin C. Now, see, generally, almost all vitamins, they are not synthesized in our body, and that is the reason these vitamins, they are supplied in the form of diet. But there are two vitamins, they are synthesized in our body. These are vitamin D and another one is the niacin. See, vitamin D, it is synthesized in the skin from 7-dehydrocholesterol on exposure in the skin on exposure to the sunlight. So that is the one which is synthesized in our body is the vitamin D. It is synthesized in the skin from 7-dehydrocholesterol on exposure to sunlight. Another one is the niacin. So niacin, it is synthesized in the liver from the tryptophan. So these are the two vitamins, they are synthesized in our body, but rest of the other vitamins, they are not at all synthesized in our body, and hence they must and should supply to diet. So one of them is most important vitamin is the vitamin C, that is also supplied in the diet. Now next point, we'll discuss about its absorption, transport and metabolism. See, absorption of vitamin C, it is readily occur in stomach, where some of the ascorbic acid, it is converted to its dehydro form, that is dehydroascorbic acid. And as we know, ascorbic acid itself and dehydro form, that is dehydroascorbic acid, they are the active form of vitamins. Now, vitamin C, it is found in higher concentration in the adrenal glands, pituitary gland, and in retina as compared to plasma. So its a concentration, it is more in adrenal gland, pituitary gland, and retina than in plasma. Then its a half-life is about 16 days, and in addition to the presence of ascorbic acid and dehydroascorbic acid, lesser amount of its catabolites, they are also eliminated out from our body in the form of urine. So as this vitamin C is a water-soluble vitamin, it's an active form, like ascorbic acid and dehydroascorbic acid, along with their certain catabolites, they are also eliminated out from our body in the form of urine. So this is all about its absorption. Now, most important point is its biochemical functions. See, this vitamin C, it plays a very important role in collagen formation. So, here in collagen, it acts as we know, this collagen, it acts as a supporting matrix for the connective tissue, blood vessels, bones, cartilages, and even the dentine. So, actually, this collagen, initially, it is synthesized as the pre-collagen molecule. And this pre-collagen molecule contains the amino acids proline and lysine. And this proline and lysine, it undergoes hydroxylation so as to form mature collagen. Already you studied the structural organization of protein. In that, you know the collagen is having triple helical structure where there is a 3 chains, alpha chains, they are twisted over one another, and there is a intra-chain lysine-norlucine bonding is there, and this bond is quite tough. So this triple helical structure is quite strong. It provides us unequal strength to the cartilages and or to the fibers, to the ligaments, and their strength is described as a tensile strength of steel. So the mature collagen, it contains a large number of hydroxyproline and hydroxylysins, which are essential for formation of cross-link in the collagen, and that gives the unusual strength or tensile strength of steel to the fibers. So this hydroxylation of proline and lysine, they requires vitamin C. So vitamin C, it plays a very important role in the formation of collagen. Now next important function is antioxidant properties. See, all nowadays in this pandemic situation, we all are taking the vitamin C. So because of its antioxidant property, see, this vitamin C plays a very important role in eliminating the potentially toxic free radicals from our biological system. So these toxic free radicals, they may form in our body in this situation because of internal damage. So these toxic free radicals, they are eliminated by this antioxidant property of vitamin C. See, this vitamin C, along with other antioxidant vitamins like vitamin E or beta carotene, it is used particularly in heart diseases. Also, we are using or prescribing these antioxidant vitamins in cancers or malignant conditions. Also, various studies show that it lowers the process of aging. It slows down the process of aging, and that is the reason we are very frequently in various clinical conditions we are prescribing this vitamin C because of its antioxidant property. Now, another studies has been shown that, see, aniline dye workers, they are very much prone to catch the blood cancer. So these factory workers who are dealing with aniline dye, they will suffer from the blood cancer. And various studies shown that intake of vitamin D, daily intake of vitamin D, it reduces the risk of blood cancer in aniline dye workers. Another thing is intake of vitamin C also reduces the risk of cataract and congestive heart diseases or cardiac diseases. See, in case of initial stage of cancer, we can very freely we can prescribe this vitamin C that may prevent the further damage or that may prevent the progress of that particular cataract. So that is the reason it is the most important antioxidant vitamin. Now next is, it plays a very important role in various metabolism. It plays an important role in lipid metabolism, hemoglobin metabolism, or amino acid metabolism also. So let us see what is its exact role in amino acid metabolism. So it plays a role in the metabolism of tryptophan and tyrosine metabolism. So we'll discuss later on in amino acid metabolism in detail of its role. But just remember, in tryptophan metabolism, this vitamin C is essential for hydroxylation of tryptophan to 5-hydroxytryptophan first, and which is the essential event for the synthesis of serotonin. So in case of tryptophan metabolism, vitamin C is necessary for what? Hydroxylation of tryptophan to 5-hydroxytryptophan, which is an important step for the synthesis of serotonin. Another one is, in case of tyrosine metabolism, it is required for oxidation of para-hydroxy pyruvate to homogentisate, and from homogentisate to malic acetoacetate. In tyrosine degradation, it requires the vitamins. So this is how this vitamin C, it plays a very important role in amino acid metabolism, particularly tryptophan and tyrosine metabolism. Now next is its role in lipid metabolism. So vitamin C is required for formation of carnitine. So it is required for formation of carnitine. And this carnitine, it acts as a shuttle pathway. That is called as carnitine shuttle pathway. This carnitine, it acts as a transporter of long chain fatty acid into the mitochondria during beta oxidation. Okay, so for the carnitine shuttle pathway or for the synthesis or formation of carnitine, we require the vitamins. Then in case of iron metabolism, this vitamin C, it reduces ferric iron to ferrous state and which facilitates the absorption of iron. So this vitamin C here also plays a very important role in absorption of iron. It reduces the ferric iron to ferrous state. In hemoglobin metabolism, degradation of hemoglobin to bile pigment, vitamin C is required. Reconversion of methemoglobin to hemoglobin, again the vitamin C is required. So vitamin C, it plays a very important role in hemoglobin metabolism also. Another most important function is phagocytosis. Vitamin helps in phagocytic action of leukocytes by increasing the synthesis of antibodies, that is immunoglobulins. So again, this vitamin C plays an important role in phagocytosis. And in case of folic acid metabolism, this vitamin C, it is required for the synthesis of THF or formation of THF. THF means tetrahydrofolate folic acid or tetrahydrofolate, which is the active form of folic acid. So for its formation, again the vitamin C is required. So this vitamin C is having a lot of role in our body. Start from its antioxidant property, various metabolisms, even phagocytosis. Vitamin C is required, and most important role it plays in collagen formation. Now let us discuss about its dietary sources of vitamins. See, vitamin C, there are so many dietary sources from which we can get the vitamin C. So rich sources are fresh fruits and green leafy vegetables, of course, and we all know the richest sources from lemon, lime, guava, amla, cabbage, spinach. These all are the rich. They are having a rich concentration or rich. They are a rich source of vitamin C. Even the germinating pulses, they also contain a large amount of vitamins. So these are the dietary sources of vitamins. Now it's a RD or recommended daily allowance. So vitamin C, it's a RDA is about 75 milligram per day, and it is equal to 50 ml of orange juice. So normally it's a RDA is about 75 milligram per day. During pregnancy, in lactating mother, and in elderly people, this RDA is about 100 milligram per day. Whereas in case of chronic smokers, alcoholics, and women on oral contraceptive pills, they require up to 125 milligram per day. So this is about its RDA, recommended daily allowance. Normally it is 75 milligram per day. During pregnancy, lactation, and in elderly people, we can give 100 milligram per day. And in case of chronic alcoholic smokers and the woman who is taking oral contraceptive pills, it's a recommended allowance. Daily allowance is quite high. It is about 125 milligram per day. Now, most important point. Deficiency manifestations of vitamin C. As we know, most important disease, that is the scurvy. So the gross deficiency of vitamin C results in a scurvy. And most important is deficiency in children. It is named as an infantile scurvy, or it is called as a Barlow's disease. So don't get confused with this particular Barlow word or term, Barlow's disease. Sometimes it may ask as a short note. So Barlow's disease, it is nothing but it is a infantile scurvy. So what are the clinical features of that scurvy? So first one is hemorrhagic tendencies there. In ascorbic or vitamin C deficiency, as we know, it plays a very important role in collagen formation. Because of its deficiency, the collagen is abnormal and intercellular cement substance is becomes fragile. So the capillaries or arteries or veins, they are fragile and there is a tendency to bleed even under the minor pressure. And clinically, it manifests as petechic, ecmosis, and hematomas. So my question is, what is petechic, what is ecmosis, and what do you mean by hematomas? See, petechic, it means, as shown in this diagram, first one, there are small, tiny, red or purple color spots are there, which are caused by bleeding into the skin. So simply, here, because of it's a deficiency, the blood capillaries, they are fragile because collagen is not proper or it is an abnormal one, as vitamin C plays an important role in collagen formation. Because of its deficiency, there is abnormal collagen is there. Ultimately, the blood capillaries they become fragile, and at initial stage, it clinically manifests as some bleeding under the skin, which clinically manifests as a red or purple color spot, which is shown in the first diagram, that is called as petechic. Then ecmosis. Now second diagram, where there is a eye ecmosis is there. See, ecmosis simply it means, the word ecmosis it means escape of blood into the tissues from ruptured blood capillaries or blood vessels. So ultimately, there is so this diagram shows there is a eye ecmosis. Ecmosis it means simply it is a escape of blood into the tissues from ruptured blood capillaries. Then hematomas, the word hematoma it means it is a solid swelling of clotted blood within the tissue. It is a solid swelling of clotted blood within the tissue. So this is the third diagram, it shows the hematomas. So all these because of collagen is abnormal because of the vitamin C deficiency. Clinically, it manifests as a petechic, ecmosis, or hematomas. So emerging tendencies there, and this hemorrhage may be either internal hemorrhages, it may be external or it may be internal. So there will be internal bleeding into gastrointestinal tract, as shown in the first diagram. Then it may be into the peritoneal cavity, pericardium, and even the adrenal glands. It may manifest as epistaxis. Epistaxis it means bleeding from nose, as shown in this last diagram. So clinically it may manifest as epistaxis. It may be clinically it may cause hematuria. Hematuria means what? And hemoglobinuria means what? See, hematuria it means presence of intact RBCs which are present in urine. That is, we can say as a hematuria. Hemoglobinuria is quite different thing. Already you know, hemoglobinuria it means it is a lysed RBCs or ruptured RBCs which are present in the urine sample. Then we can say it is a hemoglobinuria. Here there is a hematuria and melena. Melena it means because of internal bleeding, the stool may pass as a black color. So black color stool we can say as an melena. So that also gives an idea about some clues about an internal bleeding into the gastrointestinal tract. So these are some clinical manifestations, and even severe cases, the hemorrhage may happen in the conjunctiva and in the retina. So this middle diagram has shown hemorrhage in the conjunctiva or retina. So emerging tendencies there. Now this scurvy clinically manifests as certain symptoms in our oral cavity. So in severe case of scurvy, the gum becomes painful, swollen, and spongy. Then pulp is separated from dentine, and there is a loosening of teeth, and finally the teeth are lost. So gingivitis, simply it is a inflammation चल रहा है? Change now this side. Just wait for 5 minutes. There is some technical problem. Side change है. आवाज आप लोग का? हाँ? अजीब लोग का? आता है ये. पहले उसने ऐसा तो हाँ. कुछ participants. अगर सच्ची से इंटरेक्ट करते हैं तो ना इक्वेट का प्रोग्रेस रेट क्वेश्चन ना इक्वल स्टूडेंट्स का क्या पूछते हैं हम कहना आवाज तो ठीक है सब मैं क्या करने जो बोलते थे ठीक है इथुन कोई ओके इथुन नहीं है इथुन नहीं है ओके आता है इथुन नाम है ओके लेट्स सी now I will repeat so I will repeat because of some technical problem okay let it be so deficiency manifestation of vitamin C as we know the scurvy so gross deficiency of vitamin C it results in scurvy so deficiency in children it is called as infantile scurvy it is also called as Barlow's disease sometimes this Barlow's disease they may ask as a short note don't get confused with this different or different term this Barlow's disease is simply it is infantile scurvy so clinically it manifests as hemorrhagic tendency so because of vitamin C deficiency as we know vitamin C plays a very important role in collagen formation and because of its deficiency collagen is not the normal one there is an abnormal collagen is there and because of that the blood capillaries they becomes very fragile and there is a tendency to bleed so this bleeding clinically it manifests as petechiae ecmosis and hematoma so what do you mean by petechiae look at this first diagram there are tiny red or purple color spots are there that is because of internal bleeding in the skin because of the vitamin C deficiency so if there is a spots red spots are there we can say it is a petechiae now ecmosis see look at the second diagram there is a bleeding just at the lower lid of eye so there is a eye ecmosis so what do you mean by ecmosis simply it is a escape of blood into the tissues from this ruptured blood vessels or blood capillaries that is the ecmosis whereas hematoma it means it is a solid swelling of clotted blood in the tissues so here there is a high hematoma is there so clinically this internal bleeding it is manifested as petechiae ecmosis and hematoma now next is there will be a internal bleeding so there is a bleeding in gastrointestinal tract vertebral cavity pericardium or even the adrenal gland may affect or it may clinically manifest as epistaxis as we know epistaxis it means the bleeding from nose it may clinically manifest as a hematuria it means the passing of intact RBCs in the urine hemoglobinuria is a different thing it means it is a ruptured RBCs which are present in urine we can say it is a hemoglobinuria but hematuria it means intact RBCs they are present in urine melanoma because of internal bleeding the patient may pass a black color stool so black color stool that gives an idea that gives a clue about the internal bleeding or there may be a minor bleeding in the gastrointestinal tract and because of that the stool becomes black so melanoma is simply a black stool in severe cases the hemorrhage may occur in conjunctiva and in the redness now in case of oral cavity the gums become painful, swollen, spongy, and there is a tendency to bleed. They are very fragile. There is an inflammation of gums. We can see it as a gingivitis. So all this occurs because of the vitamin C deficiency. Here, even the pulp is separated from lentile and the ivory teeth may last. In case of bones, see, clinically, the bone manifestations are quite uncommon one. So deficiency results in failure of osteoblasts to form the intercellular substance osteoid, and the deposition in bone is arrested, and ultimately the bone becomes weak, and ultimately such a type of weak bones they are very much prone to get a fracture. So the first X-ray it shows a fractured bone because of vitamin C deficiency, which is a very rare condition. Now another thing is very common condition is there will be a hemorrhage into the joints, and that condition we can call it is as a hemarthrosis. Hemarthrosis. So we can see all the high cardinal signs of inflammation of this particular knee joint is there. There is a swelling, redness, then this painful, it's a quite painful condition. So pain is there, tenderness is there, and that person is not able to walk. And there is a bleeding or hemorrhage in the joints. That is hemarthrosis. It is a common condition which may occur because of vitamin C deficiency. Now next. So next is spoon-shaped nails. They are characterized by their concave shape. I show you this diagram. Look at the shape of the nail. They are spoon-shaped or they are concave shaped. These spoon-shaped nails or concave-shaped nails, we can see in two conditions. First one is vitamin C deficiency, and another one is iron deficiency. So, what is the difference between these two? In case of vitamin C deficiency, manifestation in nails are spoon-shaped nails, of course, with red spots in the nail bed, and they are called as splinter hemorrhage. So, spoon-shaped nails along with splinter hemorrhage or red spots in the nail bed, then we can say it is because of vitamin C deficiency. If there is only spoon-shaped nails plus generalized weakness, we can say that person is suffering from iron deficiency anemia. But microscopically, both is having microcytic hypochromic anemia. So if we made a peripheral smear, we can say microcytic hypochromic. Of course, another one is wound healing may be delayed, already it is told. Now, therapeutic uses of vitamin C. See, vitamin C, it is used as an adjuvant in various infections. So, beneficial effect of ascorbic acid, it is reported in the treatment of particularly tuberculosis. So, very routinely, we are giving vitamin C in TB patients along with anti-tuberculosis drug. When plasma level is kept near to saturation point. So clinical dose is 50 milligram per day. So any sort of infections, even in nowadays in pandemic situation, also in some physically or disabled patients, in cardiac patients, in malignancies, we can prescribe vitamin C 500 milligram per day. So we can prescribe tablet LIMC, chewable tablet 50 milligram per day. So because of its power to heal wounds, vitamin C has been recommended for treatment of ulcers, trauma, and even burn cases. Another thing is vitamin C in preventing cold and cancer has been scientifically supported. Although the incidence of common cold is not reduced by vitamin C, but the duration and the severity of that particular common cold and fever, of course, it is decreased or it is minimized. So, always it is a practice to prescribe vitamin C even in normal common cold and fever. And also nowadays we are taking this vitamin C in this pandemic situation. Now, let us discuss about its toxicity. So, in 1970, Linus Pauling, he advocated the use of a large dose of vitamin C, that is 50 grams per day of vitamin C to prevent and cure the common cold and many other infections. But unfortunately, the actual findings, they are not miraculous, and it is not at all advisable nowadays to give a 50 gram of vitamin C. That is not a rational one. Okay, so this Linus Pauling, he proposed that it is a cardioprotective, and however the actual findings were not miraculous as he claimed. So don't give a bolus dose or a mega dose of this such a 50 gram per day. That is not at all advisable. Now, supplementation of vitamin C mega dose can prevent the common cold. Of course, it is prevent. We can give as a 500 milligram per day for at least 10 days or 15 days, even 20 days we can give, but not more than that. Okay. So it cannot prevent the common cold, but it reduces the severity of symptoms and shorten the duration. So we can prescribe the Lipsy chewable tablet 500 milligram once in a day for about 10 or 15 days. Depends on the condition of the patient. Now last is its a toxicity. If it is given in a large dose or haphazard dose, then it may actually this vitamin, it doesn't cause a life-threatening problem, or it is not that much a fatal one, because it is a water-soluble vitamin. It can be, if it is given excess or haphazardly, it is eliminated via urine. So adverse effect of vitamin C megadose are, they are quite mild. Severe diarrhea may be there, so ultimately there will be a loss of fluid from our body. We have to connect it with IV fluids and OIs. Nausea, vomiting, heartburn, abdominal pain and cramps, even headache, insomnia, and deposition. Most important, that is very much common. Deposition of oxalates in renal system, and it causes the calcium oxalate crystals. So excess dose of vitamin C, it is not at all advisable. We can prescribe at least 500 milligram per day for about 10 or 15 days. That is enough. So these are some symptoms. If it is given haphazardly or in a higher dose, it may lead to a severe diarrhea, nausea, vomiting, heartburn, abdominal pain or cramps, headache, insomnia, or it may lead to a deposition of oxalates or calcium oxalates in renal system and causing the renal stones. So this is about the vitamin C. Thank you. Now